The policy I chose is Achieving Health Equity in the United States. The policy outlines many disparities that have been identified relating to chronic disease development. This policy also outlines how there are many barriers that magnify certain disparities, such as racism and classism. In my experience working in emergency departments over the past 15 to 16 years, is that racism and classism do not delegate what kind of treatment the patient gets. Although it has been thoroughly documented in many case studies, certain diseases are linked to certain races, either due to genetics or cultural habits. But in current times, I feel that racism and classism are not linked to this phenomenon. My project is focusing on the importance of educating the public in general about chronic disease and diabetes, all while taking an initiative in combating the incidence of diabetes through screening, behavior modification, and access to care. These interventions will be offered through the health department free of charge, while involving primary care providers to participate as well. I personally believe education is the greatest disparity of developing chronic disease, and getting everyone involved in their healthcare regardless of their ethnicity or income level is important. The policy outlines several initiatives to seek out, study racism in healthcare, and I personally feel that this funding used to study this area can be used more wisely by beefing up funding on access to care, education, and community events that promote screening and prevention of chronic diseases. When similar education on nutrition was provided to Aboriginals in Australia, who are historically underserved and undereducated, there was a significant reduction on the individual's glucose, hemoglobin A1C, blood pressure, cholesterol, and weight, which all have been proven linked to the development of diabetes and other chronic diseases.